Quetiapine Fumarate Er is a medication used to treat certain mental and mood disorders, such as schizophrenia, bipolar disorder, and sudden episodes of mania or depression associated with bipolar disorder. It can also be used in combination with other medications to treat depression. This medication belongs to a class of drugs known as atypical antipsychotics and works by helping to restore the balance of certain natural substances in the brain. It is important to take Quetiapine Fumarate Er exactly as prescribed by your doctor, and the dosage and timing will depend on your individual condition. Be sure to follow your doctor's instructions carefully to get the most benefit from this medication. Before taking Quetiapine, it's important to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the evening without food or with a light meal. Swallow the tablets whole. Do not crush or chew the tablets. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. Take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Keep taking this medication even if you feel well, and do not stop taking it without consulting your doctor. Report any new or worsening symptoms to your doctor right away, and let them know if your condition lasts or gets worse. Some common side effects of Quetiapine Fumarate Er may include constipation, drowsiness, upset stomach, tiredness, weight gain, blurred vision, or dry mouth. It can also cause dizziness or lightheadedness, especially when you first start or increase your dose, which can increase the risk of falling. Remember, this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Serious side effects may include nausea/vomiting that doesn't stop, constipation with abdominal pain that doesn't go away, restlessness/constant need to move, shaking, mental/mood changes, difficulty swallowing, loss of appetite, yellowing eyes/skin, interrupted breathing during sleep, trouble urinating, fainting, seizures, severe dizziness, and an increase in blood sugar levels. This medication may also cause significant weight gain and a rise in blood cholesterol levels, potentially increasing your risk for heart disease. Quetiapine may also rarely cause tardive dyskinesia, a condition where you develop unusual/uncontrolled movements, and neuroleptic malignant syndrome, which can cause symptoms such as fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, and dark urine. It may also increase a certain natural substance, prolactin, in your body, leading to unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant for females, and decreased sexual ability, inability to produce sperm, or enlarged breasts for males. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours. If you notice any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you notice any other effects not listed above, contact your doctor or pharmacist. When using Quetiapine Fumarate Er, there may be an increased risk of serious side effects for older adults with dementia. These side effects can include stroke, heart failure, fast or irregular heartbeat, and pneumonia. It's important to discuss the risks and benefits of this medication with your doctor, especially if you are using it to treat dementia-related behavior problems. If you are using Quetiapine Fumarate Er in combination with other medication to treat depression, make sure to carefully read the drug information for the other medication as well. Quetiapine sustained release is used to treat certain mental and mood disorders, such as schizophrenia, bipolar disorder, and sudden episodes of mania or depression associated with bipolar disorder. It can also be used in combination with other medications to treat depression. These drugs can help prevent suicidal thoughts and provide other important benefits, but it's important to be aware that a small number of people, especially those younger than 25, may experience worsening depression or other mental/mood symptoms. It's crucial to talk to your doctor about the risks and benefits of drugs used to treat depression, especially for those under 25, even if the treatment is not for a mental/mood condition. If you notice any worsening depression or other psychiatric conditions, unusual behavior changes, or other mental/mood changes, be sure to tell your doctor right away. Keep a close eye out for these symptoms when starting a new drug to treat depression or when the dose is changed. Lastly, remember that this medication is not approved for use in children under 10 years old. Before taking quetiapine, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Make sure to discuss this with your pharmacist for more details. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have any of the following conditions: eye cataracts, liver disease, low white blood cell count, seizure disorder, trouble swallowing, thyroid problems, stomach/intestinal blockage, personal or family history of diabetes or substance use disorder, heart disease, high blood pressure, high cholesterol/triglyceride levels, breathing trouble during sleep, or difficulty urinating. Quetiapine may make you dizzy or drowsy, so it's important to avoid driving or using machinery until you know how this medication affects you. It's also recommended to avoid alcoholic beverages and to talk to your doctor if you are using marijuana. This medication may affect the heart rhythm, which can lead to serious symptoms that need medical attention. The risk of this is increased if you have certain medical conditions or are taking other drugs that may cause heart rhythm issues. It's important to discuss all the drugs you take and any medical conditions with your doctor or pharmacist. Low levels of potassium or magnesium in the blood may also increase your risk of heart rhythm issues, so make sure to talk to your doctor about using quetiapine safely. Quetiapine may make you sweat less, increasing your risk of heat stroke. It's important to avoid activities that may cause overheating and to drink plenty of fluids in hot weather. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be at higher risk for certain side effects while taking this medication, so it's important to discuss the risks and benefits with your doctor. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the benefits and risks with your doctor. This medication also passes into breast milk, so make sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Quetiapine Fumarate Er. This medication may affect the heart rhythm, so it's crucial to inform your doctor and pharmacist about all the products you use. This includes both prescription and non-prescription drugs, as well as herbal products. Other medications can also impact how quetiapine works, so it's essential to communicate with your healthcare provider about any other drugs you are taking, such as antifungals, drugs for seizures, or products that cause drowsiness. It's also important to check the labels on all your medicines to ensure they don't contain ingredients that cause drowsiness, and to speak with your pharmacist about using these products safely. Additionally, quetiapine may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are taking this medication. Always follow your doctor's guidance and do not start, stop, or change the dosage of any medicines without their approval. If you or someone you know has taken too much Quetiapine Fumarate Er and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Symptoms of an overdose may include extreme drowsiness and loss of consciousness. It's crucial to act quickly in cases of overdose. It's important not to share this medication with others. Before starting and while taking Quetiapine Fumarate Er, it's important to have lab and/or medical tests done, such as blood sugar, blood pressure, cholesterol levels, eye exams, weight, and blood counts. Make sure to keep all medical and lab appointments and consult your doctor for more details. This will help ensure that the medication is effective and safe for you. If you forget to take a dose of Quetiapine Fumarate Er, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next one at the regular time. Don't take a double dose to make up for the missed one. Remember to store Quetiapine Fumarate Er at room temperature, away from light and moisture. It's important not to keep it in the bathroom and always keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.